Good evening everyone and welcome to this webinar. Before I begin, I'd like to make an acknowledgement to country and acknowledge the traditional custodians of this land and pay my respects to elders past, present and future, for they hold the memories, the traditions, the culture and hopes of Aboriginal and Torres Strait Islander Australians. So welcome to 250 webinar participants all over the country. The webinar is supporting children of parents with a mental illness in schools and early childhood services. And please let us know where you're from because we're all over Australia. So people are on webinar and also via podcast. And it's great to see people introducing themselves through the chat box and joining us from far and wide. The webinar is run by Kids Matter, and we welcome the Kids Matter, health and community professionals and early childhood audiences. Please note the case study was 2 pages long, so we do hope you had time to read all of that and found both pages in preparation for tonight. I'm Vicky Cowell and I'll facilitate this evening's webinar. I'm a social worker in private practice, and my connection with children of parents with a mental illness goes back 20 years when I became involved in research and other activities and roles in that time. And I'm on the reference group of the National COPME Initiative based in Adelaide. As a facilitator, I'm going to introduce you to the panel and chair the question and answer session that follows that. So I'd first like to introduce Mr. Brad Morgan. Brad is the Director of the Children of Parents with a Mental Illness, or known as the COPME National Initiative, based in Adelaide. And I'd just like to ask you, Brad, given you've been involved in this area now for about 6 or 7 years, and something I know that's important to the COPME area is the role of consumers and carers in developing the resources that are available on the website, and just your kind of a view of how the significance of that role of consumers and carers. Yep. That's mental health consumers and carers and their families.
No worries. Thanks, Vicky, and welcome everyone. I guess for us, working with family members, so that could be children of parents with mental illness, their parents, partners, caregivers, adult children of parents with mental illness, they're all involved pretty much in everything we do, from helping us write resources to developing workforce materials to informing some of the advice we give to governments and other organisations. And so I think for us that adds just a level of authenticity, but I hope also our resources hopefully connect well with families as the end users of our work. So I guess really they're at the centre of our work, and we sort of follow that motto of nothing for us without us, and I hope we continue to strive anyway to deliver that when we're working with families as well.
Great, thank you very much. I'd like now to introduce Laura Francis from South Australia, and Laura's been working in early childhood education for over 20 years and is currently the Community Development Coordinator at Keithcott Farm Children's Centre in South Australia. Laura, hi, good evening. Given you've been involved for 20 years in early childhood, I just wondered what sort of changes in approaches have you seen, or could you comment on in relation to young children who have a parent with a mental illness and their parents in those settings?
Sure, thanks Vicky. Hi everybody. Yeah, definitely over the 20 years that I've been involved, I think there's a much more holistic community approach to supporting all families. I have a background in early childhood and I've worked in childcare myself for a really long time. I think we're much more aware now of that, building a network for families, so starting within a childcare centre and connecting them with other support services beyond the immediate service, and knowing that that's for the best outcomes for the families and for the children.
Okay, thanks Laura very much. And finally, I'd like to welcome Elizabeth Thomas, who's here in Melbourne, and Liz has been a school educator for 40 years, with 10 years as a school principal, and she has been involved in the past with Kids Matter. And Elizabeth, sorry, I understand you're involved with the SKIPS program, which presents to years 5 and 6 in primary schools, and you have been for quite some time, and also a presenter of the SCIPS program. And I just wonder, what's one of the standout issues for you in presenting SCIPS in the school setting as a kind of a universal approach to mental health, improving mental health knowledge and understanding?
Hi everybody. Yes, I love the SCIPS program, mainly because it is something that is very direct at giving information to not only children but to staff as well, so that the right language is used within the school and between staff members, and getting people to really get a feel for mental health and the concerns, because I have seen over the 40-year period many changes in children. There is a lot more anxiety. So something like the SCIPS program is fantastic, that it focuses directly on year 5 and 6 students and gives them the support and enables their peers to actually recognise if there's any issues with their friends and know what to do.
Yeah, thank you. Yes, well, that information will be on the resources list that webinar participants receive after the webinar tonight. One of the previous slides, I think, showed the ground rules for this evening about communicating with one another respectfully and things like that. Something else I'm just going to mention, that if you find the chat box too distracting, it can be minimised by clicking the small down arrow at the top of the chat box. But please use the general chat box to interact with one another. Now, moving on, each panellist will give a short presentation from their perspective on the case study that you've all seen, and then we move on to more of a discussion. The learning outcomes for tonight are through an interdisciplinary panel discussion about Declan, Kira and their family. They're better equipped to recognise, understand and respond to the needs of children or parents with a mental illness in schools and early childhood services, and to strengthen relationships and networks that can support the child's mental health and wellbeing, including engaging families and promoting social and emotional wellbeing. And it's important to say that the case study is not meant to answer, the case study itself presents issues, and the discussion tonight is not about solving the problems but more raising questions, provoking and generating discussion. So just a refresher about the case study very briefly. It's going to explore the challenges, or it has explored the challenges faced by Kira, aged 10, and her brother Declan, aged 3, whose mother Heather suffers from a mental illness and his father Sean is often away from home, working to support the family financially. Kira attends primary school and Declan attends the 3-year-old kindergarten program in his childcare setting. Heather and Sean were able to attend a meeting at Declan's childcare after Sean disclosed to staff that Heather had a mental illness. At the meeting, they discussed the family's needs and how they might be best supported. Kira's teacher has concerns about her absences and well-being, but has been unable to meet with her family and is unsure what to do next. And Brad's going to start things off with his slides addressing the issues from his perspective. Thanks, Brad.
Thank you. So to start off my presentation, I guess what I'll be focusing on is just some key messages to help everyone understand the needs of children of parents with mental illness, some principles behind how you might respond to children, and really what I'm really hoping you take away from tonight is to have some questions and some resources to take back to your own organisations, so that you can really start some quite robust discussions in your own early childhood setting or school, just around how you currently feel, how you respond, how ready you feel, I guess, around responding to children or parents with mental illness, and what can you do to continue to strengthen that response. So looking at my points really just on this slide is we do know that there are many children who have a parent with mental illness. It's probably more common than most people realise. We're looking at probably around 20 to 23% of Australian children under 18 have a parent with a mental illness. So if you're looking at that in the room that you're working in or the classroom, it's likely that you've probably got a number of children at the moment who have a parent with a mental illness. And For some of those children you might know, and the parent might have shared that information with you, but we also know that most families actually don't choose to share that information, and there's a whole range of reasons for that, but that's a whole presentation in itself, so I won't go into too much today. So when we think about the needs of children of parents with mental illness, and I notice one of the learning objectives tonight is to be better equipped to do that, it's probably not the answer people are wanting to expect, in that I'm not going to give you a sort of checklist of signs or behaviours or things to look for. And the reason for that is just that it's so variable, and if you're really thinking about their needs do move across a continuum, and they continually move across that continuum. They're not stuck at one point across that continuum any time. So if we're thinking about the room or classroom, we do know that in the context of children of parents with mental illness, some of those children will be thriving, and then there'll be some that you might have a brief period where you sort of notice things might be a bit different, and you're thinking, oh, should I do something about that? But then everything seems to be a bit better again. Some children you might notice where they have a crisis that pops up suddenly, and that's had significant impacts on them for a brief period. And then there's going to be others in your classroom or your rooms where they have daily challenges that really impact on their everyday well-being and learning. And then there's others that will also be flagged with you, I guess, around where you have concerns about their well-being or safety as well. And I think a helpful way really to think about the needs of children of parents with mental illness is to think about that continuum of need, and that they're really not stagnant on that continuum, and that they'll move back and forth across that, and some will only stay at particular ends than others, but the idea is how do you support them to move towards, I guess, the well end of that continuum, and what resources and networks you can access to support that to occur. Having said that, we also do know there's a population group that children of parents with mental illness do have social, emotional and developmental educational vulnerabilities that other children might not have higher rates of that than children who don't have a parent with mental illness. But we also know that there's also doesn't have to be problematic for children, and that children and their experiences from mental illness can actually nurture strengths as well as provide opportunities for their growth. And so from a conceptual lens, I guess it's just encouraging people to recognise that the range of experiences will be highly variable, as well as their level of well-being at any one time as well. And so what my key message really just to take away is that we don't label or make assumptions about parents with mental illness and their children, so we're not assuming that they're going to experience difficulties, but the other message is we can't assume that they won't either. So really it's probably quite difficult to give you a toolkit other than to say that your relationship with children provides you with unique understandings that a lot of other people don't. And as you can see on the slide there, some of that key message that I guess when you're thinking about your role in the context of in schools and early childhood services is to think of yourself as a caretaker of children's well-being. And what I mean by that is we do know that children's social and emotional well-being is dependent on access to supportive and nurturing relationships in the context in which they live, in which they learn and when they play. And in that home and in the community, we generally recognise that parents or foster carers or other caregivers are the ones that nurture their well-being in that setting. And then in the early child and school setting, it's actually the educators who spend the most amount of time with children who are, in a sense, just like parents, in that their relationship in that context is paramount for the child's social and emotional well-being. And so when thinking about your role, when you're thinking about supporting children of parents with mental illness, you're really in a unique position compared to a lot of other people that work in the sector. Unlike, there's a lot of professionals that come in and out and spend a brief amount of time with children, but teachers and educators are there understanding children in a daily way. They have a strong relationship with children. And as a consequence, I guess it's really the role of educators to create environments that support growth and development across all areas that will then enhance their learning. And even in that context, when you're thinking about your role as a caretaker, it's not just what you teach that supports children's well-being, but also how you relate to them and how you relate to others. And this is where your relationship with their parents is also important, and particularly in the context of parental mental illness. And then the other opportunity that you have as a caretaker, and this is something that can be a bit more challenging when you're working with parents with mental illness, is that opportunity to collaborate with other caretakers. So, for example, an educator collaborating with a parent. And the purpose of that is because the needs of children are so variable and operate across that continuum, is how can you together understand children's wellbeing? What do you as an educator need to know to help you support children to thrive in the context of the classroom? And so that might not be that you need to know lots and lots of details about the parent's mental illness, but you might need to know enough information to say that we've noticed certain things about the child. Have you noticed these? Is there something I can do, or is there information that I need to understand to help me in my relationship with the child? It's not necessarily about how you help the parent in their parenting, and I think that's probably something just to keep in mind, is what do you need as a nurturer or a caretaker to help you support the child's wellbeing. The other message, I guess, that I wanted to get across today really was that parental mental illness and lots of family challenges are very common in the community, and probably are more the norm, I think, rather than the exception. And so for you and for the school community, it's really thinking about setting up responses that feel where you feel confident, your organisation or your setting feels confident reaching out to support children and parents with mental illness. I think one of the challenges, I guess, of engaging with families that a lot of people express is that it is hard. And so as a tendency, we tend to attract ourselves as educators or as workers when we're finding it hard to engage with people, where really for what I'm hoping, I guess, that you can take away and think about tonight and take back to your organisations is how do we actually reach out to families and support children rather than retract, particularly when it might be quite hard to engage. So I might just go along to my next slide to say that I think Kids Matter components do provide a strong foundation to help you engage in that process, and there's probably a little bit more thinking that you can take back after tonight to think about how you can strengthen that engagement. So when reflecting on the case study that I saw, that everyone will have seen tonight, some of the key things I noticed was the early childhood setting. There seemed to be quite a strong relationship between Declan and primary caregivers, where they actually are able to notice changes in Declan and even notice some of the things that might have been happening in the family. The relationship was strong enough with the family where the family was comfortable actually sharing their experience of mental illness, and we're actually able to engage with the centre around what are we going to do next, and that is really quite ideal and what we would hope. In the school setting, the strength in that one was that the caretaker relationship of the teacher meant that they were able to notice changes in Kyra's wellbeing and some of the behaviours that they noticed in school, to the point where Kyra is actually comfortable sharing some things that she noticed about her own family. And I guess where I noticed probably in both scenarios where there was, I guess, some areas for further conversation as an organisation is really those next steps, but also some of those questions around readiness as well. Something I sort of was noticing in the early childhood setting was the worker feeling unsure about what to do with the information when it was shared, so responding in the moment, but also, should I share this information with the team leader? And then in the school, it was sort of the next steps of this child, I've noticed some of these changes, they've said something to me, what do I do next? And the recommendation that another teacher said was to call child protection and make a report. So on the next slide, I'll go to really what I won't be able to answer all of the questions, but I think to take away back to your organisations is actually to use this case study to help you and your schools and your early childhood settings to have a conversation around readiness and how ready you feel as either an organisation or as an individual educator to respond to children of parents with mental illness. And so some of the questions I've posed up there, which you can take back to your teams, is really thinking about using that case study and going, if this was in our school environment, what would we do? What could we do? What mechanisms could we put in place to build on this? So if you're feeling unsure about procedures around information sharing and things like that, what sorts of conversations can we have? What policies and procedures can we set up? Also thinking about when you're having those conversations, who is able to help progress some of this work around strengthening our readiness as an organisation to respond to families. Examples I've listed up there are things like Kids Matter action teams, if you have them. Are there other organisations in the community that you connect with? our job descriptions actually represent what we need to do in the context of working with families where there may be vulnerabilities? What professional development do we need? The other thing is really thinking about what networks and pathways of support are available in your area for children and families. In the resources, there is a download of an activity that helps you and your team sort of think about resources available for children and resources available for adults and mental health services, as well as how can we support families in the context of relationship difficulties as well. The other part about organisational readiness is that culture of communication in the school about mental illness, as well as outside as well. Do we share information in our school about mental illness? Do we put newsletter items that sort of normalise and say that lots of parents have mental illness, here's some information, resources available? But also we also talk about the culture of, I guess, the staff room culture, or talking by the water cooler as we're filling it up. Well, what is our culture of communicating about families? Do we have a very problem-oriented focus? Are we talking about how bad things are and sort of, I guess, perpetrating that communication of feeling hopeless? Or do we talk about and share stories of, positive stories of making a difference as a community, and how do we do that? The other area of readiness is really something to think about personally, and that is in the context of that case study, but also other scenarios of how confident would you feel responding to that? What would you do? What would you need to feel more confident? Who can support you? What resources can you access? And then some other questions. I think Kids Matter provides a very good foundation in understanding children's mental health, but what do you understand about parental mental illness or adult mental illness? And understanding that in the context of how might that impact on your engagement with parents. It can be quite easy, I think, sometimes to feel personally affronted when you've tried to reach out, but you're not getting reciprocal engagement from the parents. And sometimes it's helpful to understand the reasons why parents might not be able to engage. It might be the symptoms, it might be the treatment that they're actually going through, actually making them really unwell or making them feel quite lethargic. And we saw that in the context of this scenario where the mum was taking medication which made it very difficult for her to get out of bed, but also affected how she was feeling in general. So I think that's quite an important thing, and I think there's tools, and I think Elizabeth's going to talk about this a bit more, such as SKIP, the program which helps the school understand mental illness in parents and adults. And then the other thing I mentioned was just that context of when you're talking about parents with mental illness or children of parents with mental illness, how do you frame that? Can you make that sound positive around how do we share stories about making a positive difference in our school community? Because I think that when that's the dialogue in the community of the school, it helps to create more positivity and hope, which is really important, obviously, for children, for ourselves as staff, but also for families as well when we talk about hope. And I think that's all from me. So as I said, it's really just trying to take these questions back to your own organisations and then saying that there are resources available such as Kids Matter, but also the COPMI, or Children and Parents with Mental Illness National Initiative, has some resources directly for schools that you can use. And I'll hand over to Laura now.
Thanks, Brett. Thank you, Laura.
Thank you. I'm going to talk a lot about early childhood settings because, as I mentioned earlier, that's my area. Certainly reiterating a lot of the points that Brad has raised around the relationship. So I'm going to talk a little about a centre level support that we would put in place for these families, but also all families, and then more family specific types of support. In the case study that we were given, it really reiterated for me, and certainly for any of us who work with children, the importance of that key relationship. In early childhood, we would talk about a primary care relationship, and we would talk a lot about attachment theory. But do we share that information, and how do we share that information with families? Certainly in the scenario, it demonstrated to us, as Brad mentioned, that relationship between Declan and his primary carer, Emma, and why that is so important to all children. What we can also be doing, though, is then extending that learning out for our families. There's some amazing Circle of Security programs available in our community that certainly our early years educators are attending, but we could also be encouraging our families to attend as well, or certainly attend them in partnership even with our educators, so then it's shared learning. What it also talked about within the scenario was that Declan utilises his favourite activities as a bit of a bond with his educators, but also with his bond with his time when he's at childcare. I think it really reiterates for us how important that, having that secure base is for children. And again, that goes back to the Circle of Security and having a really strong attachment for children. In the scenario, it also talked about the relationship with Emma, and that Declan was upset if she was leaving the room. And again, there's opportunities for us to build those key relationships with the children, even as the non-primary carer in the room, but certainly with a team of educators working around him. One of the things I also wanted to address was about the special childcare benefit. For registered childcare centres in Australia, the special childcare benefit helps to offer more childcare where appropriate for families. To access the special childcare benefit, it's through Centrelink, and families are eligible if they have a diagnosis under a mental health issue. They can provide that information, whether it's through a nurse, a GP, through mental health care services, to the childcare centre, and that can enable them to provide an extension of care for the child. So in this scenario with Heather, the mum having to access some support through the hospital, if the centre was able to access that special childcare benefit arrangement, it would mean that Declan might be able to have some more hours of care within the centre, and obviously that then reiterates having that secure base while mum needs some support. So moving on, within my role, I sit within a children's centre, so we have children under 5. My position is as a community development coordinator. I work for the education department. We also often have family support coordinators in the children's centres who have a social work background. I guess in that sense we have the luxury that we have additional educators within the team that can look for support outside of the childcare for families. Again, it reiterates how important it is for us to know what is available for our families within our local communities and within our wider communities. We can then help families such as Heather and Sean to draw those connections to wider support for them and wider support for the children as well. Certainly we would be welcoming those private conversations, as was highlighted within the scenario. And again, being very mindful, as Brad said, around the confidentiality for families, and making sure that the way we support families is free from our own bias and our own judgment, but trying to support what they need. There's certainly lots of opportunities outside of the community outside of the children's centre or a childcare centre to draw in that extra support from the community, and it may even be other families. The thing that I wanted to really touch upon is the sensitivity that we all need to have when working with all families, as we know. As Brad was saying earlier, is that some families that are experiencing mental health may be at different levels of wanting to discuss this with other people, and it really is about that child-centred approach first in an early childhood setting, and being able to offer that wraparound service for the family. I think it's about, again, being warm, being open, and being available to the family so that they can share, whether it's with that primary care relationship initially, but then obviously it may be beyond the centre as well, within having that strong relationship with the early learning service.
Okay, Laura, thank you very much. A bit more there.
That's okay. Thank you, Vicky.
Okay. Thank you very much indeed. We'll move along to Elizabeth now, talking from her perspective as a former school principal and involvement with other programs. Thanks, Elizabeth.
Oh, thank you. From a school perspective, this case study is quite interesting because it really draws the differences between the child care setting or kinders and school. And it was interesting that the family felt quite happy or a lot more relaxed in being able to disclose Heather's illness with the childcare centre rather than the school. And this could be for a lot of different reasons. And one of the main reasons is that when families drop their children off and pick children up from childcare or kinder, they need to sign their children in, which is quite different to school settings. So the family may not be involved with the school as much as they are with the childcare setting, and that could really explain why Sean was quite happy to disclose the information that he did and for Heather to go and have that conversation. I would hope that there is more information about Kira in regard to what the school knows about this family. If Kira has been at the school for a long time, if she's in grade 5, then I would suggest that the school does know quite a bit about the family. And school settings are quite large compared to the smaller childcare and kinder settings, and as such, schools need to approach things probably slightly differently. But as Brad and Laura have said, relationships are the most important aspect that needs to be developed. So we need to make school life for Kira as safe as possible for her. We need, as a whole staff and a whole school, really respect and support mental health issues. And that can be done in lots of different ways. So schools are able to create and maintain environments that do respond to developing health, mental health as a positive thing, and the education department really promote healthy minds and thinking about yourself in a positive way. Now, we know from research that we're not going to support Kira and her family if there isn't a whole school approach. We know that if there are engagement and wellbeing policies within the school that everybody knows and understands, that families know what they are, there is consistency, there's routine, there's order, then Kira will feel a lot more positive about coming into the school setting. We also know that we need to embark on more than the academics. We actually do need to teach social skills and emotional wellbeing. And in my 40 years, I've come across a few programs or processes that I think are fantastic. The Tribes process is wonderful. It's a whole process that encompasses learning and wellbeing and looking at the way we can support students on lots of different levels. We also know that Kids Matter is paramount. In the school that I have just retired from, Kids Matter was our overarching guideline in making sure that we were on a positive track in looking at mental health and what were we doing within the school, what do we need to do to further an understanding not only with our staff but also to the wider community. And Kids Matter was a great way of ticking off probably the little boxes, but making sure there were lots of great discussions around mental health and what can we do as a whole school in order to make it so that everybody feels comfortable talking about mental health and promoting wellness. We also need to have other programs such as STIPS, which I talked to about earlier. We, in schools, we do a lot of fantastic work in regard to resiliency and emotional well-being, but there are times when we need to be specific and give really important information about mental health in a way that is using the important language, really training up our staff so that they know about mental health. And when we have run the SKIPS program quite a few times every 2 years, my staff learn something new every single time they hear the information. And with the SCIPS program, they actually are introduced to somebody who is going through or has experienced mental illness, and listening to people who have come through that or are working through it is really a wonderful way of really understanding it a lot deeper than just reading a book and really looking at and having conversations with other people. So we need to have those sorts of things within our school as well. Now we really need to equip the staff to really know what to do for families, and in this case we have got a family who haven't come to the school. They haven't disclosed what they are going through at the moment, but staff know, the students, and Jo, Kira's teacher, has noticed lots of different things happening with Kira. So if she's been at the school for a long time, a lot of staff probably have noticed that, and there would be conversations around that. And in my schools, and I'm sure it happens in lots of schools, we talk about families that we have concerns about. What have we noticed? What do you think could possibly be happening? And it is important for Jo to know that he's not on his own. And from the case study, it feels that he's on his own and he's got to make these great big decisions by himself, which is not the case. There should be protocols in place for Jo to be able to go to the principal or the leadership team and discuss his concerns about Kira and what can I do, how can I help this family, I know there's something going on, and work together as a team. That's really important. We also know that we need to give families and children lots of different strategies, and as has been said before, relationships are paramount. Now often we might find it difficult to have conversations openly with parents who are experiencing a mental illness, but if we are able to and they are coming into the school, then we can have those talks and maybe we can identify things that are happening. It is important that teachers know their students and have developed a safe environment within their classroom where the likes of Kira really are happy to talk to their teacher, or as Kira in this case, she's explained that, you know, mum can't get out of bed but she doesn't know why, and that's terrific if there was a relationship there. Sometimes you might be alerted to what's happening by other parents. They might be concerned. They might know Heather, and all of a sudden, you know, things aren't going so well. You know, what's going on? How can I help? And schools, depending on the size, a lot of schools really know their families well and know that in this case, I would hope that the school does understand what is happening for this family. We need to identify ways to communicate with parents, and sometimes that can be really tricky, as Jo has found out. And once we've made contact with the parent and we've talked to them about ways that we can help them, there are lots of different things that could be on offer. We might have parents who might be able to bring Kira to school if Heather's not feeling very well, if she's really tired, her medication is taking a while for her body to get used to. Parents might make food or provide ways for Kira to do extra activities outside of school so that Heather feels supported when Sean is away. And we really need to build that sense of community, and that comes about building relationships, having conversations, having programs within the school where there's lots of conversations about ways that we can support each other on different levels. Now, some schools are fortunate enough to have lots of resources, and if the school is lucky enough to have a welfare officer or student wellbeing person or a chaplain, some schools have counsellors within their on their staff as well, and we would be getting referrals so that Heather and Sean accept Kira's being able to go and talk to people on a confidential level. We know that there are lots of different services out in the community. Again, just as the childcare would offer, we would explain to the family all the different things that are available to them and reassure them and hope that they feel confident enough in disclosing how they're feeling and recommending ways that we as a school could actually help them. We need sometimes to assist families by having counsellors or extra people within the school so that Heather doesn't have to physically drive somewhere else, that she knows that she can just come to the school. And it's really important that you know your family as well and put in lots of different things within the school in order for that to happen. Now we need to equip all students, not only the carers. A lot of children are having a lot of difficulties these days. I've seen a lot of children anxiety more than ever before, and we need, as a whole school, inform children about healthy lifestyles, positive mental activities, through positive activities and discussions. We might do activities for Mental Health Week, we might have Harmony Day, we might have relaxation days, where lots of discussions, relaxation techniques are actually taught to the children so that they know how to cope if they're feeling down or things are becoming too hard. So Kira at this stage, she's lashing out, she's not happy, she's arguing with other friends and children within the playground. She isn't herself, and she will need a lot of support in being able to learn to control her emotions. And in that way, sometimes you're dealing with Kira in a different way than you would with other children. You might have a timeout spot for her where she's not in trouble, just a place for her to cool down. You might, during the school time, if she's feeling restless, have a space in the classroom or give her a job to do so that she is leaving the classroom so she can think and calm down. Lots of different ways that you can support her. You need to give Kira the opportunity to ring Kids Helpline if she needs to, and Kira doesn't know what's happening. So when the conversation is had with Heather and Sean, perhaps it could be discussed that they actually need to explain to Kira what is going on so that she really knows what's happening, so otherwise she's just imagining lots of different things. Now we know that it can be really hard, and Heather alluded to this in the case study, that she didn't want the school or the childcare centre to know what was happening in her life because she didn't want her children to have a backlash from other people. And unfortunately that still happens, even though schools are a lot more open now. They do have a lot of information in their newsletters or on their websites. Some schools have signs around. They offer information. There are still people within the community who find it really difficult to understand what to do or say. And hopefully through engaging in Kids Matter and working with the community, then those sort of feelings and understandings can be changed and moderated. Sometimes it is really hard to engage with the family initially, and you need to be quite ingenuitive about which ways it might work for different families, and that communication between reluctant families, it's all about building relationships and having a better understanding what's actually happening for them. Thank you.
Thank you very much, Elizabeth and Laura and Brad, for your presentations. I suspect those presentations may have answered some of the questions that some of you did submit before tonight's webinar. The next little segment is our panellists had questions for one another. So I was going to ask Elizabeth if you would like to ask Laura the question you had. Have you got that in front of you?
I do. Laura, what other professionals might an early childhood collaborate with when a parent discloses a mental illness? And how do you manage confidentiality around this? You did alert to some of that earlier, so can you just elaborate on that?
Sure, thanks Elizabeth. I think it is definitely about confidentiality. I totally appreciate that families do build those strong relationships with key educators, whether it's teachers or primary carers or other educators within the services. If a family was to, share about a mental illness with one of those key people. I think it's about giving that opportunity to listen, but also to explain if there's another person that needs to be brought in onto that conversation. So whether it be a counsellor within the school or perhaps the director of the early childhood service, but explaining to the parents why that's really a key, that it's about being able to provide support for the families and for the children. There's certainly, as I touched on earlier, a range of agencies available in the community for our families, and sometimes it's about building that connection for the parents as well. It wouldn't, in many cases, be enough to provide a contact number and a phone details. It's about actually maybe inviting someone from, say, Centrecare or from Uniting Care Wesley, who run some amazing mental health programs, or from Kids Matter, to come out to the service, maybe provide an information session for all of the families, but they may also be able to talk more one-on-one with that particular family that has been speaking with the educator. Again, I think as long as the parents are aware of who's being brought into the conversation and what those reasons are, I think generally they appreciate why people are being involved in this situation.
Okay, thanks very much, Laura. And Brad, you had a question for Elizabeth.
Yes, and this probably relates a bit to the scenario we've just talked about anyway, but this one's for Elizabeth. From a school perspective, how do you start conversations with families where you aren't sure, but are wondering if they do have a parent where someone might be experiencing this in the family?
This can be quite tricky in some situations, but if you know the families, sometimes that is quite handy, but sometimes you may not. And usually if you engage with the family around the children and your concerns around the children, then the parents are more likely to have a conversation with you, because as Heather alluded in the scenario, that she was very concerned about her illness and the impact that it was having on her children. So if you feel that there is something happening, then you would try and contact that parent in lots of different ways. Now, in this case, Heather didn't want to be contacted because she didn't really want to disclose what was happening. But if you ring and there's no answer, then leave a text message, because that enables that person then to answer when they feel ready to do that. Some people like an email, so again, they're ready. When they're ready, they can respond to that. If you're really concerned, maybe you try and catch the parent when they drop their children off at school, or pick them up. If you know exactly the spot, you could be waiting there, so you could just have a quick chat and get that relationship happening, so that the parent might feel a lot more confident in being able to talk to you about what's going on. If you're really concerned and you can't get in touch, then sometimes the principal could make a home visit and find out what they can do to support the family. But on all terms, you do need to be very sensitive about what you say. You wouldn't outrightly say, I think you've got a mental illness, what can we do? You would really need to be very tactful about the conversation that you have with the family, so that they're ready to disclose when they're ready to do that. And again, you really need to build that relationship and just keep trying and really persevering in trying to make communication happen between you and the family, because often when you ring the first time or the second time, the family may not be ready. But if you don't do it the third time when they might be ready, then you've missed that opportunity. So it's really important for you to persevere. Thank you.
Okay, thanks, Elizabeth. And I think, Laura, you had a question for Brad. Thank you.
Thanks. Brad, I was wondering whether you would be able to provide us some examples of resources that we could use within schools and early childhood settings to support continuity for children. So the example in the scenario was that Heather had been in hospital for periods of time. Is there resources available to support these families that are having those changes in their family life?
Something we have available, and I think a lot of mental health services also use them as well. We call them care plans, but they've got a few names, and I might even post a link on the chat probably while we've been talking about it in a second. But what we recommend is that parents do a care plan, and what that does is it specifies a just-in-case scenario so that if parents are, for example, going to hospital or unable to temporarily care for their children, it helps them to identify who else is important in a child's life, who might be able to keep the child's routines going. And then the idea of the care plans is that parents fill those in, and it gives those caregivers the information that they might need to help maintain children's routines, as well as a lot of other information such as who's their doctor, who's their worker. And I think that type of concept we encourage parents to share with their childcare setting as well, because I guess it helps the childcare setting or the school setting also to go, okay, what can we do in the context of our few hours with that child to make sure it feels routine for them and that things continue. And the other part of that, something that quite often happens in families is the extracurricular activities like sports or drama or music and things like that. Is there a way, if parents can't, is there a way that the school could provide or the care service could provide some access to those ways to get to those types of activities that help children just feel like things are continuing? And I noticed Lisa on Kids Matter just put up our care plans on there, so that's good. Thanks, Lisa. And so you'll get to see their templates that we encourage parents to complete themselves and then choose the information that they want to share with others as well. But the other thing I think in the context of that is generally schools and early childhood services do have a routine that's quite well established, and that in itself is quite important for children and gives them some security when things might not be going so well at home. And that, I guess we can't underestimate the importance of just maintaining those routines in the school environment and engaging with that is quite important.
Thanks very much, Brad. And thank you for responding to one another's questions like that. I think it probably answers some of the questions, as I said, that people have submitted. There are a few more. And one of them kind of relates to what you just talked about, Brad, and what you covered perhaps early on as well. One of them, when somebody has asked, does being raised by a mentally ill parent predispose a child to future mental health problems? I wonder if you could address that, Brad.
Yes. So I guess what, and I sort of raised this a little bit in my previous slide, but
yeah.
As a population group, we do know that there is a higher percentage of children who have a parent with mental illness who do develop their own mental illness as teenagers or adults or as children than those that don't have a parent with a mental illness. But the message with that as well is that it doesn't mean that they will either. So there's an elevated risk, but it doesn't automatically mean that it passes on from generation to generation. And the positive thing that we do know is that there's quite strong evidence or emerging evidence that we can actually reduce the likelihood that that's actually going to occur as well. And there's a whole range of examples of methods and interventions that are currently being implemented in Australia and overseas that are showing that we can actually reduce that likelihood as well.
So there's kind of the health promoting steps that we can take.
Yep.
Such as, involving children in activities, having another support person in their lives, or many of the things you've already mentioned. Yeah. Okay, thank you very much. Elizabeth or Laura, would you like to add anything to that?
No, I think that sounds great.
Okay, thank you, great. Another question relates to, and it's quite an interesting one, how to help a child explain to their friends what is happening for their parents. Perhaps Elizabeth, would you like to start that answer off to that one?
Yes, this can be quite tricky. I have had children try and explain to their friends, and this is again where we need to have those programs within the school where the children do feel confident about talking to each other. If you have circle times, you have conversations around being healthy, and also that there is mental illness and that it's something that is discussed within the classroom, so that the teacher might be able to support the child and being able to explain. I've had parents actually come in and talk to the classroom about what is happening for them so that they have a better understanding. It just depends on the level that the family wants to become involved and how confident they feel in that. But we just need to support that child as best we can and not leave them on their own, because they need to explain to their friends exactly the right sort of information and not make it, more difficult for them.
Yes, yeah, thank you. Again, Brad or Laura, would you like to add anything further to Elizabeth's response to that one?
I might just make a couple of comments. And I guess this is something just in the context of giving children that dialogue. I guess when we've spoken to a lot of families is the importance of actually parents being the people that support children to share information if they choose to, and what types of information that they share. Unfortunately, children can get access to a lot of inaccurate information as well, or quite often might not have developed the understanding of the conversations happening at school. So I think probably the step before even giving them appropriate dialogue to share with their friends is probably the first step, is actually giving the family the opportunity to make sense of and understand what's happening themselves. And I guess the leaders around that is the parents themselves.
Okay, thank you. Time is ticking away, so perhaps as a way of concluding and your last thoughts, I'd like to ask each panellist actually this question from somebody. What are the key messages that each panel member would like the webinar participants to convey to school colleagues and the wider school community about supporting children and families with a mental illness? And while that's being responded to, maybe Laura, would you like to start that response? I'll just repeat the question. What are the key messages that each panel member would like webinar participants to convey to school colleagues and the wider school community about supporting children and families with a mental illness?
Sure, thanks Vicky. I think it's absolutely about a key message being that mental health is something that affects pretty much everybody at some point in their life, and it's about how we as community support each other. I think that we've touched on some amazing programs that are available for schools and for early childhood settings within the community, such as Kids Matter. And I think it's about having that ongoing conversation and talking as a professional team about how much we value health and wellbeing for our children, and that starts from birth, and how we share that information with our families as well. We can certainly bring in extra support for families, as we've touched on. There's lots of amazing guest speakers, psychologists, all sorts of people available that can come and talk to families as a group. So we're not singling people out. It's about supporting everybody in the community together. For me, that's absolutely a key message, is about being able to support everyone, because you never know when it might be you, and that then people have less shame in coming forward and being able to ask for support from one another as well. So thank you very much, Laura. Elizabeth, could you respond to that very briefly? We've only got about a minute left. Thank you.
My main message is that mental illness is in the community. It happens. A lot of principals and schools say it doesn't relate to any of our children. We're fine. And I think we need to be realistic about what we need to do within our schools. And yes, academic is very, very important. But we know from research that if we don't get the safety and the wellbeing side looked after, and make sure that our children want to come to school and feel good about coming to school and have a really good understanding about their own self-worth, then the academics will suffer. So it's really important for us to have programs within the school. We need to be realistic about the fact that we need to actually teach our children about what we can do to be healthy, not only physically and emotionally, but mentally as well.
Thank you very much indeed. And finally, Brad.
I think probably the key message I just want to get across quickly is just to say that you're not alone in this, and you shouldn't feel alone, and that there's a whole range of resources available to help you, I guess, improve your readiness around working with children and families in the school and early childhood environment. And in that context is really just taking some of these questions and even this presentation and case study, just take it back to your own teams and start an ongoing conversation about this, even if it is just allocating it to a team meeting or your school staff meeting agenda for 10 minutes for the next 6 months, so that you can actually have these conversations in a deliberate way, just to get this, I guess, get this process starting to think about how we can strengthen our readiness to respond and support children and families.
Excellent, Brad. Thank you so much. And thank you to all our webinar participants from Tasmania to Townsville, from Kalgoorlie to Cooktown. And thank you for your questions, and we hope that some of them have been answered in what has preceded this evening's webinar. Don't forget to complete the exit survey and check out the last few slides for the information that was on them, and you will receive some material after the webinar, I understand. So thank you very much again, and we'll say good night.